Okay, welcome to Deuk Spine and Deuk Joint. Put pressure. I'm Dr. Deuk Majan. We have just literally finished the Deuk laser disc repair procedure on a patient with, who's going to rotate the hip? Thank you. So we need to push the knee inward.
Yes, sir. Yep.
Make sure the patient doesn't come off the table. I don't know if that helps. Shot? Yeah, that looks better. Well, we don't have a big posterior tubercle anyway. Sorry, talking to my team. But we just finished the Deuk laser disc repair, 5-1, for disc pain. Now we're going to fix the piriformis. Shot? Is that it right there? Yes, all right. We're going to do a small incision. It's 4 millimeters. This patient has a torn piriformis muscle, and because of that, they're having horrible pain in their buttock on the right side. Piriformis pain can also affect the sciatic nerve and cause sciatica. The way that happens is the patient's sciatic nerve runs through the piriformis muscle, and when the piriformis muscle is angry and tender, shot, then guess what? It gets onto the sciatic nerve, causes the sciatic nerve to be angry and tender. So the sciatic nerve, the effect on the sciatic nerve is a result of the piriformis muscle inflammation. Piriformis is the second most common cause of sciatica. All right, you can see the tip is sitting right on the posterior tubercle, right where the piriformis muscle attaches. So I'm going to release the muscle off this tubercle. Now, other doctors do this open, and like I said before, it's extremely painful for the patient with a very long recovery. I think we're good, Luis, there?
Yeah.
Mm-hmm. So you can see right where the tip of the probe is, I am literally releasing the piriformis muscle off the top of the hip. What does releasing mean? It means cutting. Cutting. Here I can feel the fibers. They're extremely tense. All right. So you hear it? Can you feel it in the leg?
Yes.
Yeah. A lot of times we can feel it holding the leg. All right, here you go. Shot. I'm right on the back of the femoral neck. I'm at the bottom of where we need to be. I'm going to finish the release right here. And then we're going to move north a little bit. There's still a few fibers left. I can still feel them. Shot. Now, unlike the Deuk laser disc repair with the disc, this procedure actually can be painful, unfortunately. It hurts. The patients will complain about buttock pain, you know, for a few days. Shot. I'm just using my x-ray machine to figure out where I need to be. Shot. Because you can't really see things with your own eyes. You have to use the x-ray to navigate. I'm using the x-ray to navigate. I'm pretty much done. I just have a few more fibers to release. All right, that's it. We're done.
Sitting down, please. Thank you.
Take the fluoro out. Let's show the audience. You guys see this tiny little cut? It's an outpatient procedure.
Yes, we do.
And it's, we want to get the eye band out. It's image guided, meaning that we use the fluoro to guide us. In spine and joint procedures, it's very common to use machine like a fluoroscope to guide you. Here goes a staple. I'll just put 2. And she'll have a little bit of blood in the muscle from the procedure, which goes away body dissolves it. But very safe procedure. We do a lot of these here now because they work and patients get great relief long term. All right, any questions?
Just one question coming from Lanu on YouTube,
Yes, Lanu.
asking, I have relatives that own medical facilities and monthly expense is always high. Public
Yeah.
needs to know if a free surgery is impossible, but why are some still requesting free surgery?
Yeah, Lanu, I don't know. You're right. It's very expensive to run this facility. Very, very expensive because I don't cut corners and I won't let anybody here cut corners. We actually have, 6 nurses here at the surgery center today for, like 2 patients at a time. And, we believe in having the right healthcare providers and the right equipment and the right medications. There's always corners you can cut to save costs and make it cheaper, but it's impossible to do it cheap if you want to do it properly, with high quality, safe care. So I don't cut corners. I will not allow it. And unfortunately, we have to pass the costs on to the patients or the insurance companies. We do have insurance companies pay, but not all of them will pay. So it's just case-by-case basis. All right, thanks, Henry. You can end the stream. This is a Piriformis release, right side, at Deuk Spine Institute and Deuk Joint Institute. Piriformis is the 4th most common cause of chronic back pain.